Chapter 3, the U.S. and Public Health Care System, Sandra Monk. The objectives, we're going to look at the events and trends that influence the status of the healthcare system, talk about some of the key aspects of private healthcare system, look at public health and explain the roles that nurses will play in this care, and then look at some of the public healthcare systems in the United States, and then examine nursing roles in the selected government organizations. So to begin with, this chapter describes healthcare system transition as it struggles to meet evolving global and domestic challenges like Affordable Care Act, the many other, our global economy, how looking at, infectious diseases that are globally and also occur in our domestic space, and how a nurse is going to help to play a pivotal role in meeting these needs. Ideal health care, and this is something you can write down, I don't have it on this slide. Ideal health care would be essential for all, for everyone to have access. We would have care for all with a focus on self-management. And then individuals and communities would take responsibility for their own health. Forces stimulating change in the U.S. healthcare system. If we look at the demographic trends, we've talked about this through several classes about people getting older with more chronic illnesses. The United States healthcare costs being the highest in the whole world, with being 17% of the gross domestic product. So, what constitutes good health does not indicate that people are really getting their money's worth, is what we're seeing in the United States. So, in the 21st century, we're looking at all kinds of social changes. We're looking at domestic like terroristic attacks. We're looking at humanitarian care. We're looking at infectious diseases, and we're looking at the economic downturn. And in addition, as we talked about in another lecture about the technological trends, that we continue to be able to do more, but are we doing it at the risk of persons suffering, even though they are not, even though they live longer. And I don't know why we keep having that pop up. I apologize for that. Okay, forces stimulating change is also, so just to talk about those a little bit more, specifically speak to the demographic trends. We have increased fertility and increased mortality. The replacement rate is that more persons are being born, or as many people are being born as are dying, and so that is we have more that are being born than we have deaths. So the population growth of the world continues to be steady and steadily increasing. Also, we also talked about that we have an aging baby boomer generation between 1946 and 1963, and we're just now beginning to see the maturity of the baby boomers as they turn age 65 starting in January of 2011. We have an increasing average age. People are living longer, and that is contributes to a declining mortality for genders in all age groups. We have changing composition in U.S. Households. We have many more single families, single parent families than we have ever had before. 66% of African American families are led by single female members of the as head of the household. Also, Native Americans have a high amount of single women who lead the household. Also, there's some changes, other changes, growing foreign-born population in the United States, and there's been a change. The largest minority group is no longer African Americans. It is now people who are from Hispanic or Latino populations, and whites are predicted to make up only about 50% of the U.S. population by 2050. And so the major number of persons coming to the United States from other countries is from Mexico and also from Asian countries. And the mortality, people over age 50 have the greatest rate of chronic illnesses and use a larger portion of health services than any other groups. And so, as we have said, that it no longer does infectious disease is the leading cause of death. Now it is chronic diseases. Changing lifestyles also have an impact on the United States healthcare system. Um, to be healthy, one must take care of themselves. So as I've said, ideally, that would be ideal health. Everyone would have access to health care, but then people would take care of themselves and communities. And there is a growing appreciation for the quality of life, and our values are shifting as a society towards changing the importance of financial success. So just because we're putting money and technology and resources, does that mean that we have quality of life? And there are changing compositions of families and living patterns, as I have mentioned before. Household incomes are increasing. The average per person income is increasing. I would say that is in some areas. That's probably not in all areas. And there's a larger gap between the richest 25% and the poorest 25% is really widening. And so we realize that in this society that middle income persons share a bigger burden, or at least that's what is suggested, that they share a bigger burden of healthcare costs. And that certainly was evident during the economic downturn of 2008, when many people were laid off from their jobs. And then the Affordable Care Act is another, and we talked about that this week, about the Affordable Care Act and what the purpose of that was. There are not enough primary care providers. That's why they say that nurses are going to be very important to primary care. 60 to 80% of prevention type services could be performed by an advanced practice nurse. We also know that the advanced practice nurses need to be out in the community for this to happen. They're not going to be, there are going to be some in the hospital, but more so out in the community. And so current nursing shortage is going to have some impact on that. By 2016, we expect about 600,000 new nursing positions, and at the same time, 55% of the surveyed nurses over age 50 plan to retire between the years of 2011 and 2020. And so we need one of the things that we really recognize that we need in nursing, and we need generalist nurses, not just specialty nurses, and not just specialty, higher advanced practice nurses. We're going to need a lot of generalist nurses, and we need, and some of you say that's what you want to do, and that's really a good thing. And we need to increase the number of minority nurses to help decrease health disparities, because if we have minority nurses, the perspective is going to be very different than if we just have people who have all similar backgrounds. And so that's something really important. And just one of the figures on that is in 2008, minority nurses represented only about 22% of the RN population. So although there are nurses, minority nurses, there are not the number, and there's not the number of them who are in advanced practice positions either. So hopefully that's something that you're going to go forth and change in nursing. Forces stimulating the change in the U.S. healthcare system, technological trends like telehealth, particularly like in rural areas, in long-term care and home health and hospice. This is something that can be helpful to be able to assess and provide interventions for patients who live in settings like this. So there's positive effects of that. It improves healthcare services. It reduces costs. It's a very efficient means of delivering care. You can't really ever completely replace people with machines, because it's what we put into the machines, the people put into the machines, the data, that is what makes machines successful. And it creates more time, conveniences for time and travel. Also, the negative effect can really increase costs. So high-tech equipment is expensive, it quickly becomes outdated, and it often requires highly trained personnel, in addition to keeping your personnel trained in these areas. And there's legal liabilities also related to confidentiality, so the potential for decreased privacy is there, and also too much reliance on machines, which increases safety, can increase. It was meant to electronic medical records were meant to improve safety, and we know with medication administration it definitely has worked. If you follow all the steps with the electronic medical record, it can really help. And we hope that it's going to help with portability of medical records, although we've not really seen that yet in healthcare. Generation O, just to go back, Generation Y, I mean, some people are more comfortable with technological trends, with computerized portals where they call in and find out about their appointments, or they try to gain appointments that way. But not everybody is, and so we still have a generation of people who are not as comfortable as Generation Y, for example, with technology. And also there's a digital divide for persons who just can't afford technology. And so that's something that must be taken into consideration as well in our patient care areas. Current healthcare system in the U.S., the cost, the Great Recession, we might have been even called a Great Depression, that we had around 2007 to 2012, and we still have not recovered from yet. 7 million people lost jobs. That means 7 million people lost insurance for at least some period of time. We have the aging baby boomer generation, where we have increased Medicare enrollment. And then we have the Affordable Care Act that we don't know. We know there's some positives, we know there's some negatives, and we don't know exactly what all is going to happen yet. This is an important concept for this lecture. There is a two-class system for access to care. We have private insurance for those with insurance who can pay for health care, who are viewed as receiving superior care. And I'm not sure that's true if insurance is a part of that. And then there's also public, which are those who depend on public funds, like your Medicare and your Medicaid. And then you have also the uninsured, who are the working poor who don't qualify for public funds, who either make too much money or who may be, undocumented immigrants to the United States. And you can, the Institute of Medicine frequently makes reports on, quality, and have asked for the improvement of quality. They have stated that nurses are going to be part of that plan. It was in a report called To Err is Human, Building a Safer Health System. It came out in 2000. And also Keeping Patients Safe, Transforming the Work Environment of Nurses in 2003, where they spoke about long hours of nursing and how that impacts health care. And then also you can go on the web and look for hospitals and actually compare and see what their quality records are, like deaths, infections, and so forth. So you can actually compare those. Organization of healthcare system. An enormous variety of facilities and providers make up healthcare systems. I mean, just think about the complexity of that. And in general, and I think I just said that on the other slide, so I don't think I need to go over this. So we have private or personal care, which is, you have primary care or community health care centers, and then you have public health, which is the public health system. And for an example, physicians and dentist offices, managed care organizations, nursing homes, mental health centers, rehab, local, state, federal, official, and voluntary agencies. So everybody is working together to provide health care, and that's not always coordinated. We've been talking about this for probably 20 years, how health care, the organization of health care, is not organized. Or it really is not. Excuse me. Primary care versus primary health care. Primary health care is broader than primary care. The setting for primary health care is within all communities of a country and involve all aspects of society. So primary care versus primary health care. Primary care, you're talking about, the care that people need to have and should have access to at all times. So now we're going to talk about primary health care. It includes a comprehensive range of services, including public health, prevention, diagnostic, therapeutic, and rehab services. And the result for many, there's many different efforts that go into that. I mean, we're looking for agriculture, education, communication, technology. A lot of stuff go into that comprehensive range of services. Care should be made universally accessible to individuals and families in the community. And sometimes there's different things available in different communities. I mean, a rural community may have something totally different from an urban community. And is it affordable? Primary health care also encourages self-care and self-management in health and social welfare of daily life. The Declaration of Alma Mater talked about health care for all by the year 2000, and then in 1979, globally, or in our society, United States, we came out with Healthy People 2020 that began to talk about goals. Only they were Healthy People 1980, and they change every decade, and now we're up to Healthy People 2020, and they look at goals to attain high quality health care, longer lives, free of preventable disease, disabilities, injury, and premature death. Um, we want to eliminate health disparities and improve the health of all groups, create physical and social environments that promote health for everyone, and promote a quality of life. So if you were to go to Healthy People 2020 and look at that website, you'd see you can search it by different age groups, by different disease processes, but it's all about prevention and about in the community and how people can live longer and better lives, which are great goals. Primary care defined. You want to know this. This slide in particular refers to personal health care that provides first contact and continuous, comprehensive, and coordinated care. It includes managed care like HMOs and PPOs. Managed care, as a definition, it uses primary care as the starting point or the access to care, and it requires that family choose a care provider from the managed care network. So you would be asked to choose a provider and you would go through them, and then if you needed additional services like to go to the dermatologist, some managed care companies require you to go through them and get that referral from them. Some of them have changed that a little bit, so it just depends. Depends on that. And then there's Medicare and Medicaid, and we talked about that this week, what Medicare and Medicaid does. But know about managed care and about HMOs as well, and those are under a managed care network. The public health system, it is mandated by law and developed in local and state and national levels, and it seeks to ensure the health of the community is protected, promoted, and ensured. That's something I would underline also. It overlaps with the primary care healthcare system. It doesn't provide all primary services. It's mandated through laws that are developed at a national, state, or local level, and it's organized into multiple levels of federal, state, and local systems. And at the local level, health departments provide care that is mandated by state and federal regulations. Under the federal, we went over these, so I don't know that I'm going to go over these again, what the different ones do. Do be aware of what the AHCRQ is, though, because I want you at some point to go there and look at the clinical practice guidelines and just see what all is available there. But that is your, all of these are important, and we talked about these in a lecture for 6, 7, and 8. But the Agency for Healthcare Research and Quality, I think, is a very important one to know about as you go forward in your education, to be able to see what the best evidence-based practice is based on public health and other types of care. Federal, state, and local systems. It was started. The State Board of Nursing was started to cooperate and collaborate and move more closely in the past few years, and so as far as in the state, the increased focus is on emergency preparedness and on response to prevention and to emergencies and so forth. Local health departments are services and programs offered by the local state departments. They vary. We've already talked about that, and they're going to be varied based on the needs of the community and available funding and other resources. What I was trying to say when I first started this, and I know I got it kind of jumbled up, but the federal, state, and local systems, we try to get them to coordinate and collaborate more closely in the past few years. And the reason for that has been because of the type of emergencies that we've had, like 911, like Hurricane Katrina. And so, we've had the development of, like some new programs like, the office, that manages, disaster management, with FEMA and Homeland Security. So we try to work more closely together at federal, state, and local systems. So that's what I was trying to say when I first started talking on this slide. And I think I've already gone past that slide, and that's why I was okay. And forces influencing healthcare systems of the future. Consumers, fewer people are satisfied with the healthcare system. We all want lower cost and high quality healthcare without limits. And we want to improve the ability to choose providers of our choice. So those are some things that people are asking for, and you see some changes in that, but is that how healthcare is going to be? I don't know. Employers want to be able to obtain reasonably priced basic healthcare plans for the employees, because decreased profits for the employer if they're paying higher prices for insurance premiums, just like decreased profits for insurance companies if they're having to pay out higher dollars because of increased healthcare costs. So it's all tied together, and healthcare systems want a better balance between consumer and purchaser demands. So healthcare systems, they've got to be able to balance their bottom line too, or they won't even be able to exist. And so what legislation is concerned with is helping all people have access to care and still maintain the quality that continues, that people continue to request, and that it should be a right of all persons to have access to care and quality care. Improving health care, the American Nurses Association is always seen that the United States and the healthcare pyramid was upside down, and that's one of the things that is talked about in the American Nurses Association. That it would require a real cultural change if the majority of funds were spent on preventive care instead of high cost secondary and tertiary care. So it really would be a lot more logical to have a system that builds on a base of public health followed by primary care and then specialty care. But we're not there yet. We haven't caught up with that yet, and hopefully we will by the end of your careers. And then the integration of primary care and public health is very necessary for the future health of the nation. So whether that is Affordable Care Act and the insurance marketplace and the direction we're going in that, or it's something else, I do not know what to predict on that. And that is the end of Chapter 3.